Now, Inishkaji Nubber, and I should also indeed wish the Minister for Health and the Ministers every good wish, because I do believe that the public healthcare system has been left virtually a wasteland by your predecessors, and it's going to need an awful lot of good work and hard work to restore the services to the level they should be at. Now, Sligo General Hospital, first of all, I should explain, is a very special place to me and to the people I represent in Sligo Leitrim. I worked in it for many years. All of my children were born in Sligo General Hospital. My mum, Lord rest her, died in Sligo General Hospital, and my grandchildren were born in Sligo General Hospital. I saw it grow from a fairly small hospital with just medical, surgical, maternity services to a hospital which had many specialties and top-class clinical specialists working in it. It serves the people of Sligo, all of Sligo, all of Leitrim, West Cavan, South Donegal, and even North Roscommon. And if we had any kind of proper cross-border healthcare, it would also cover the people of Fermanagh. Up to 2009, the hospital provided a consultant-led breast cancer service to women who were unfortunate enough to develop the disease. And it was originally intended by the HSE in all the reports that Sligo General would be nominated as a centre of excellence, would be one of the centres of excellence for breast cancer services in Ireland. Because the hospital did have the required specialist staff, it did have the required facilities, and it was providing a service that was, in very measurable terms, a standard of excellence which matched or bettered any other centre in this country or abroad. And yet in 2009 the breast cancer services were withdrawn from Sligo General Hospital and transferred to University Hospital in Galway. Now, and despite massive public protests throughout Sligo, Leitrim, Donegal, and indeed at the gates of Leicester House here in Dublin, and I was at them myself, despite those protests and despite the wealth of information clearly indicating the quality of the services in the hospital, that decision went ahead. And your predecessors, as Minister for Health and Children, pressed ahead with that transfer against all that evidence, with the connivance, it has to be said, of the Health Services Executive and with their scapegoat, Professor Tom Keane. The Minister has now gone her way and Professor Keane has gone back to Canada. But 1 minute left. But for the women who are suffering from breast cancer and for their families in Sligo, Leitrim, Donegal and West Cavan, they continue to suffer. It's wrong that somebody has to spend up to 6 hours a day travelling 5 days a week for treatment in Galway, and that is happening. It is wrong. It should not be allowed to happen. And it's scandalous that fine, hard-working staff at Sligo General Hospital are on occasions driven to tears from frustration because they don't have the time to give proper care to patients. Because it's not just cancer services, Minister. Orthopaedic services, we've closed 60 beds in Sligo General Hospital over the last 2 years, and the waiting lists are getting bigger. It's scandalous, it's wrong, it shouldn't happen. Now, the Labour Party and Fine Gael, in the run-up to this general election, did promise that cancer services would be restored to Sligo General Hospital. In the Labour Party's case, they promised that it would be done within 100 days. No ifs, no buts, no preconditions, no predications. They said it's a red line issue for participation in government. 100 days, Minister, and I am counting. Carmil Magat.